I just didn't want people staring at my mouth. I didn't want the metal brackets. I didn't want to deal with the attachments or the things that stick to your teeth rubbing on my gums. It looked uncomfortable and mostly aesthetics. I just didn't want the big metal braces in my mouth.
The advances in Invisalign have increased over the past 10 years as much as the cell phone has increased. It's been truly amazing to watch, and they're on the forefront of all the technology that has been out there. So now we are completing cases which used to take up to a year in 6 months. I think the profession has seen some of the ramifications that you get when you have bracket and wires. Once the bracket and wires are off for traditional braces, we do have a lot of patients who are exhibiting these enamel wear and staining after wearing it, the gum problems that come with that due to the difficulty in cleaning around them. Invisalign for teen and adults is a nice way to straighten your teeth in a very friendly environment for your gum and bone as well. If a tooth is out of position, it's more difficult to clean. You'll get higher plaque buildup between the area. You can develop cavities between the teeth because you're not cleaning the teeth properly. So I really stress that the benefits of Invisalign, besides the cosmetics, is really for the gum and bone health and overall health of your mouth.
I met with Dr. Korecki, and he asked me what my chief concern was about my smile, and I didn't like how I had some crowding in the front teeth, and I didn't notice it until I had seen photos of myself, and I just noticed that my smile wasn't as great as it used to be. And so I met with him, and he told me about Invisalign, and he did a scan of my mouth, and he was able to email me a digital copy of what my smile will look like over time, and it looked great. And so I met with him and we started treatment.
For someone looking to straighten their teeth, what we try to do is not just diagnose that this tooth is rotated or out of position, but what caused that rotation. And from there, we're able to develop the correct treatment plan for each patient. I really base it as a teamwork process where the doctor and the patient are overseeing the treatment at least once a month, so we can track to see how your tooth is moving. Unfortunately, not all teeth move as predicted, and it varies from patient to patient. If the tooth is not tracking in the aligner, it can get exponentially worse if you switch to the next aligner and the one after that. I will be there every step of the way to monitor that and make any changes accordingly.
It's amazing how a little change in your smile makes a big difference. I feel like I only had one tooth that was driving me crazy, and most people would say, your smile looks great, why are you doing this? But I noticed about halfway through that one tooth that was driving me crazy was actually going into a position, and it just felt so good. And I had been on vacation and we were taking family photos, and I just noticed, wow, my smile looks so much better and we're not even done yet.